Hello, this is Dr. John Wallman. This is a series of presentations about the COVID-19 pandemic and reasons for calm. This particular episode is a short one on virulence, and these are based on statistics from March 21, 2020. So first, what is virulence? Virulence is an infective agent's ability to cause damage in its host, in the person who's got the infection. So death is the ultimate damage that can be caused by a pathogen and would be very high rate or type of virulence. Now, so with death, you can measure how virulent a particular infective agent is very succinctly and very clearly by looking at the mortality rate. And the mortality rate is the deaths divided by the confirmed number of cases. And this is an excellent way to measure the ability of a pathogen to cause damage. Now, besides mortality, there's many other things you can look at, and we'll get into that. Morbidity is one of those things we can look at to get another handle on how virulent a particular pathogen is. And morbidity is the rate of disease or ill health that you get from any particular infective agent. Now, knowing the rate that you get any particular symptom varies tremendously. And the importance of it varies tremendously because you also have to look at the severity of the particular symptoms or common sequela that you get after the disease. So for the COVID-19, the most common persistent symptom that people get after they've been infected is pulmonary fibrosis. And it can be as bad as the lung capacity is reduced up to 30% after they recover. Now, that has to be put into context very quickly because the frequency and persistence of the pulmonary symptoms, it's way too early to tell. Now, why do we know that? Well, first off, there's just not the time yet to deal with people afterwards and find out how many of them got it. But then even once we find out how many got some kind of pulmonary fibrosis, we need to find out how long it lasts. So someone, they might be congested after they get this, and the breathing's a little restricted for a week, maybe for a month, maybe permanently. And a lot of that is going to depend on if they get treatment and how good they are with the treatment. Do they do the breathing exercises? Do they do whatever else is necessary to stretch and break the fibrosis within the lungs? So persistence, again, emphasizes how long after the initial recovery the sequela from the disease last. So is it a day after they recover, a week that it lasts, months after it lasts, after they recover, or permanently after they recover? So the initial estimate is that frequency of any persistent symptoms is likely to be in the ballpark of 0.1 to 0.3% of those infected. Now let's put this into a little more context. We've got some very high-ranking people. The Inspector General from the World Health Organization on February 28th said, quote, "Most people will have mild disease and get better without needing any special care," end quote. From JAMA on February 24th, 2020, Journal of the American Medical Association, we have, quote, "Current best estimate is that about 81% of people with COVID-19 have mild disease," end quote. And to put that into context, mild disease is undetectable or insignificant symptoms. Overall, looking at a number of different studies, they're coming up consistently in the range of 80 to 86% of people who get infected with COVID-19 will have no or limited symptoms that do not result in hospital or doctor's office visit. Now, let's put that into a little more context by comparing it to the flu. 31.4 million outpatient visits per year were for the flu in the United States. That's the average. And this is from the National Institutes of Health. Also from that organization, we have the annual number of flu cases that result in hospitalization in the US at about 200,000 per year. COVID-19, so far we have 22,708 confirmed cases total, whether it's no symptoms, mild, moderate, or severe cases. 22,000 total cases versus, well, let's see, COVID-19, there are currently 279 mortalities in the US and approximately 500 intensive care unit visits total. Those numbers are going to go up, but we are well away from the number of outpatient visits and hospitalizations of the flu. Bottom line, this disease is relatively mild. It looks like it's going to be comparable to the annual flu. Let's look at the statistics for mortality rate compared to other diseases. I finish off every video presentation with this one slide. If we look at rabies, if it's untreated, it has virtually a 100% mortality rate. Same with prion disease. Virtually 100% people who get prion disease die. Ebola, mortality rates between 40 and 90%, depending on the country and the outbreak. Nipah, 77% mortality rate. Bubonic plague, 60% mortality rate. MERS, 34% mortality rate. This is a relatively recent outbreak. SARS, 10% mortality rate. Again, another fairly recent one. The flu, annual flu, averages 0.1% mortality rate. And COVID-19 is likely to end up with a comparable or even lower mortality rate than the flu. So, once we start understanding this, and to some degree, these factors have been known for over a month, is this a medical crisis or an induced social crisis?